Hello, I'm Inoka Veerasinghe from Sri Lanka. Uh, this is a case study of public health strengthening in action from Sri Lanka. In this presentation, I'm going to present the basics of dengue control as an example of local public health in Sri Lanka, the processes of performance improvement and the lessons learned. Considering the staffing for public health in Sri Lanka, at the field level, we have two key figures who collect the data. One is the public health midwife, who is usually a lady or a female, and a public health inspector, who is a male. Then there is a supervising public health midwife, who supervises the public health midwife, and they do the active surveillance data of maternal and child health. Another figure is a supervising public health inspector, who does the supervising of public health inspector, and they collect the disease surveillance, environmental health, trade health, water quality data in the area. Considering vector control in Sri Lanka, mainly environmental reduction of mosquito breeding habitats is done. We promote proper solid waste disposal and improve water storage practices, and also larvicides. In addition, breeds of fish and copypods that feed on the mosquito larvae, and we rarely use spraying insecticides. Dengue is a viral disease, and these dengue notifications are sent to the local public health office, usually from the hospitals. These hospitals include both the government and the private hospitals. So the public health inspector gets these notifications from the public health, from his local public health office, and he will do the investigations within 24 hours most preferably, but it can be up to 3 days sometimes. So he goes and investigate this patient, whether he may be in the hospital or he may be in the field after discharging from the hospital. So all these patients are, he goes to all these patients in clinical suspicion of dengue and no need to confirm the patients. So after this, he looks at all his investigations, and if there is a clinical diagnosis, then he gets that record as a clinical diagnosis, or if there is a serological diagnosis, he puts it as a serological diagnosis. However, for both these diagnoses, we will continue with our dengue control activities. So in this dengue control activity, the premises of the patient and the surrounding areas are inspected for Aedes mosquitoes, and also in the surrounding area, including his house, his or her house, a house-to-house survey in the previously demarcated area and the adjoining areas is done, and also other environmental controls are applied. The local health department prepares a map of the dengue clusters as well. When we get one patient, there may be no other patients surrounding as well, and in a dengue outbreak, usually we get clusters of dengue patients. So this spot map is produced. So in Sri Lanka, going door to door to ask people if they have dengue is seldom necessary, because there is a very high availability of health care in the country, and also the doctors usually they don't they go for serological diagnosis, but this is costly, and so costly confirmation of serology is not done for each and every patient, and also not in the public health office as well. But there are private patients who can purchase the serological testing if clinically the clinicians have indicated. Furthermore, the health department does the routine larval surveys. Monthly, the entomological survey reports are sent to the medical officer of health, who is in charge of this public health inspector and the supervising public health inspector. So they get together and they analyze in which areas are the mosquito density is very high, and also regarding the containers with water in the area. So how is this outbreak control done? It is mainly through a house-to-house survey. Mainly the public health inspector, the supervising public health inspector with his team and together with the community, they go and look for the dengue breeding sites, and also if there are any more cases, they get those information from the community, and they get that data also to the public health office, and also on the spot they give the necessary health advice for the community and sometimes the referrals as well. So this medical office of health gets all this information in the public health office, who is in charge of all this, all his team, and he sketches the epi curve with the available data. And this all this information is continuously updated, and mainly the spot map is updated every day, and in the outbreaks it is usually done in the morning and also in the evening as well. Then for the dengue breeding site detection surveys are carried out, and the weekends will be the ideal days for the community to participate in them. These are some photographs of dengue breeding sites, especially the tires which are discarded, where there can be water collection inside them, and the garbage with polythene, and even the leaves, dried up leaves, where they can have collections of water, especially after the rainy season when it is getting dried up slowly and slowly, but there can be small amounts of water pockets in them. And also in these surveys, the PHIs or the public health inspectors, they detect various types of water containers in houses, and also gutters, and also the roof gutters. In the floor also there can be collections, and the abandoned gutters by the people, and various types of containers in the area, and also the abandoned sites of building construction. Mainly they can see, you can see how what has collected on those. Especially the clean water is needed for the Aedes aegypti mosquito to grow. So and also these polythenes and big sacks where they are abandoned by the people, which gives very good opportunity for these Aedes aegypti mosquitoes to breed. So considering all these things, this public health team, they do initially a cleanup program in the area, and also and after that more and more cleanup programs at the field level. And for this, only the public health office staff will not be enough. It is not sufficient. So the medical officer of health and his team decides to get the intersectoral coordination and to get the participation of other sectors like the government agent. In Sri Lanka, there is one government agent for each district who is responsible for all the uh, all the administrative work in the district, and he gives support, and also the police, the Mahaveli authority, that is, Mahaveli is a river, and this authority, they are in charge of doing all the cleaning work in the rivers, and also the education department, who gives us support, that is for the health department, from the schools and the school children. And then the local government, we call it Pradeshya Sabha. Those local government office, they are responsible for the garbage disposal, and also other governmental institutions where whenever we can get support, and religious institution, they do a great work by collecting all the community and the people, and also the area volunteers and the area community leaders. So all these sectors get together, and we organize campaigns to do cleanup programs. So, uh, pe- so officers from each of these institutions and the community, they get together and support public uh, the public health office to do all these cleanup programs. In addition, the public health unit or the public health office in the district, they organize awareness programs targeting various audiences like the schools, community, and also the officers of governmental institutions, and also for the religious institutions. These are some of the photographs where the police and the education ministry people and the public health staff, they all go from house to house, and they how they did this cleanup programs. And these are some awareness programs that are done for the public health, for the government institutions. And this is how they are done. These photographs depicts how they go and inspect for all these places. And in this photograph, this is given how the school principals have arranged their teachers to inspect various areas of the school. So there is a timetable, and they do it according to this. In the surrounding area, if there are schools, they are given this plan by the medical officer of health, and they do accordingly for this. So for this outbreak, the cause of the outbreak was an abandoned gutter by joining the local authority officers, two officers of two areas of this local authority. They have abandoned a gutter because thinking this area is not mine, and the other local authority thought that it is not their area. So this was a hidden thing. This area was not known by anybody who is under control, and so they have abandoned this gutter, and it has caused a big amount of Aedes aegypti mosquito to breed and to produce this outbreak. So the control activities in the area was carried out, including a ring around the hot zone, and Shramadana campaigns. That means people are coming and volunteering to do the cleaning up programs in the adjoining area of the gutter together with the community volunteers was done. And then after that, the medical officer of health sent the message and convinced all the local government that was really responsible for this area to do the cleaning, to help in the cleaning and also doing the renovation of this gutter, and it was done. So the mass inspection programs planned by the MOH and the supervising public health public health inspector in collaboration with the government agents, office staff, police and community leaders were carried out even after that. And then during this mass inspection programs in the hot area and the surrounding area, many residents received the notifications from the public health inspectors because they found dengue breeding sites in their households and their lands. So the medical office of health office staff and other together with the other sectoral people, they carried out continuous control programs because they found various other places with these dengue breeding sites. And even after reminding them about these things again and again, when the public health staff went for the same places, they got to know that only a very few people had the same dengue breeding sites, and they were not obeying the notifications. So then they had to go for litigation and for fines as well. Following all these programs, the dengue outbreak was under control, and because there were no more cases notified from the area, and this led to the success of the program. So, how are we going to improve the district public health practice in Sri Lanka? Here, mainly in Sri Lanka, we practice the supervisions. There are routine supervisions done by the respective higher rank people. It may be a medical officer of health or a supervising public health inspector who is doing the supervision of the public health inspectors who are doing this work. And also, uh, uh, when they carry out the programs, the public health supervising public health inspector or the medical officer of health go to that field area, and he do the supervisions on the field as well. And also we carry out special supervisions as well without telling them, because we have the plan with us. We go and supervise them without prior notification for them. So for this we use the observations and also the checklists. Another main thing in improving the public health, district public health practice is the training programs carried out for the field staff. Because in Sri Lanka the field staff get transfers 4 yearly, and this is mandatory. So we get new people every day for the staff. So we need continuous training programs. Otherwise, our public health practice won't survive very well. So monthly we have a separate date in our district public health office for the people, for the public health staff to get a training. This is called in-service training day for them. And in this in-service training day, we provide them with training pertaining to various aspects. And in this, dengue and the public health practice, dengue prevention, all these things, the medical officer of health has a plan, and according to that plan, he gives these trainings continuously. Then another thing is the investigation of the selected notifiable diseases. Dengue is also a notifiable disease, and as soon as the notifications are received by the public health public health office, they are sent to these public health inspectors for investigations, and this is a very good practice in finding out all these disease outbreaks and the control of all these notifiable diseases. And also another thing is investigation of deaths. Mainly this was practiced initially for maternal deaths and infant deaths, but nowadays we practice it for deaths for some special communicable diseases and also non-communicable diseases and also injuries as well. Then another strong aspect that we are always concentrating on are the reviews. We have quarterly reviews, biannual reviews, and yearly reviews on these various aspects of public health practice. And for dengue prevention especially, we have biannual reviews. And in these reviews, we get all the data from each public health inspector, and we individually, the medical officer of health and also other consultants get together, and all these experts, they review the public health practices done so far in each area of this, not only on the public health inspectors but also on these public health midwives as well. So these give them reviving of their knowledge and also what they miss in the practically in the practice what they miss, they can get to know from the whole staff and share their experiences and then improve their knowledge on prevention activities. So for these activities, we need in Sri Lanka there is a whole group of human resources. There is of course, to give the consultations and to give the technical guidance, there is a district consultant community physician, and the next in rank will be the regional epidemiologist, who is responsible mainly for the dengue and the other communicable diseases, and he collects all this data and present it for the CCP, and under him there are the medical officer of health. So he is responsible for each medical officer of health area, and he presents he sends his data to the RE or the regional epidemiologists, and this medical officer of health gets the data that is supervised by the supervising public health inspector or the SPHI, and our field level key feature is the PHI or the public health inspector. This is mainly regarding dengue and other communicable diseases in Sri Lanka. Lessons learned on performance improvement. Improvement of continuous surveillance with strict supervision by the middle level managers is mandatory, because even though we use the surveillance activities, we need them in a manner with more strict supervision, because if we lose one or two, even one or two cases in the surveillance activity, then there can be massive outbreaks sometimes by the time we learn that we have got these cases. Next will be the quality improvement of household dengue inspection surveys and larval surveys. Although routinely and also in special situations, we do more and more dengue inspection surveys and larval surveys with the help of people from other sectors as well. Although the surveys are there with the numbers, but still the quality may be a problem, and it was a problem because in some areas these surveys are done, even larval surveys are done, but still there were outbreaks. So the quality improvement of these surveys is very necessary. Then the increment of health awareness among the community is also another issue, because at field level, although the district medical office is carrying out various awareness programs, mass media, through the mass media, if we can arrange more and more awareness programs and the key health messages and the prevention activities, then it will go to the community in a far more better way than the ones that the district medical office is doing. Another thing is the proper garbage collection and disposal plan of local authorities. In Sri Lanka, garbage collection and disposal is done by the local authorities, but there are several problems in this because some people they don't get a proper place to go and put their garbage, and from the local authorities they are not coming at the proper time that is given in their plans, and then this garbage get distributed everywhere, and also they sometimes 2 or 3 days they get collected in one place, and this gives a uh, very good opportunities for the Aedes aegypti mosquitoes to breed. So this proper garbage collection and also disposal plans. Most of the local authorities they don't have a proper disposal area. So these things need to be more and more improved and strengthened, and proper plans need to be implemented by the local authorities. Thank you.